I got a $7,000 bill for going to ER. And I want to share my story today, my Bernie story on why I support affordable health care and how I think personally we can make healthcare affordable not only for the people but also for the government. Now, if you look at this little snapshot, it's a bill I got fairly recently. It was a very acute condition. I had to be rushed to ER, and I had insurance at the time. I'm with my own business, and so, I have low income health insurance. And when this happened, there was so much panic. The person who was with me just rushed me to the closest ER. And turns out that my insurance doesn't cover the ER I went to. It covers the ER that's twice the distance away from my home. Now, ER should always be covered regardless of which insurance you have. So that's really tricky, thinking or not knowing that certain emergency is not covered in insurance. And how are you going to know that? Maybe do your research beforehand and remember it when you have a time of emergency, and then also drive much further away, I guess. I don't know. It's kind of a dangerous situation. You have to go to ER close by. So this is something that shouldn't have really happened. I shouldn't have gotten this bill. My insurance should have covered it. And so knowing this, I really think that we should have a health insurance that's free, right? A lot of countries like Denmark and, even Canada has free health care. I do think health care can be affordable for both the government and the people by just including alternative medicine in our healthcare. Now, here's what I mean by this. 13% of our out-of-pocket medical costs are spent on alternative medicine, none of which is covered by insurance. National Institute of Health did this comparative analysis of benefits and cost between alternative and conventional medicine, and they found that generally the results are better in alternative medicine and the costs are lower. So that means if the government covers insurance that also covers alternative medicine, then most likely they will be spending less on that insurance if people are going for alternative medicine, alternative therapy options in general. And here's another study that shows that 75% of our future doctors think that we should include alternative medicine in our health care. So because Bernie is for free healthcare for all, affordable healthcare for all, I really support that. I think that's extremely important. And I also hope that we can include in our health insurance some alternative medicine. That way we can be healthier and spend less overall as a country. Now, if I just look at my chart right here, you can see that I would have spent a lot more using traditional medicine as opposed to alternative medicine. And now just because that's true for me doesn't mean that's true for everybody, but this is just kind of general support of the preliminary results and research that they have done. Now, if I was given an option between choosing an insurance that covered traditional medicine and alternative medicine. Now, do remember naturopathy is covered in regular insurance, but when I say conventional or unconventional medicine, right, complementary medicine, alternative medicine, I'm including everything. I'm including yoga, meditation, rolfing, which has helped me a lot, stem cell therapy and cryotherapy, all those other types of things that are not included typically and you have to pay out of pocket. So if the price was the same for an insurance that only covered allopathy and an insurance that only covered unconventional medicine, given that they both still cover naturopathy and emergency care, if the cost was the same, I personally would go for alternative medicine. So I really hope that Bernie can help us bring affordable healthcare in this country, because nobody should have to make a choice between saving their life and going into debt.